Hi, my name is Michelle Winkel, and I'm an art therapist and a director of an international art therapy program called CiiAT. My personal art therapy journey began over 25 years ago. I had already begun a career after finishing up a university degree, but felt it wasn't the right choice for me and it didn't feel creative enough. So I began some self-exploration through painting and discovered my next passion. A few years later, I began a master's program in clinical art therapy at Loyola Marymount University in LA. And it was a perfect fit for me. It was my way of being able to make sense of the world by exploring imagery and collaborating with others. After graduating, I worked for about 15 years in California in a wide variety of settings because art therapy has such diverse applications. I worked in hospitals with people with mental illness who spent weeks and months in the hospital, and others who came to day treatment programs. I worked in a shelter as the family art therapist with children and their moms who had left their homes due to domestic violence. I also worked with clients with HIV who were searching for meaning and comfort as they battled an illness. I worked with infants and their caregivers who had attachment disruptions, feeding challenges, sleeping problems. I feel very lucky to work with such purpose and creativity on a daily basis. And because of my work with so many kinds of people, I still passionately believe in art therapy. What is art therapy? Well, it's a professional practice that combines arts-based creativity with psychotherapy. It helps us access emotions that are beyond words. What is it not? Well, it's not coaching. It's not art instruction. It's not therapy for people who go to the museum. It's not diagnostic per se. It's not fortune telling. I could go on. People often ask me if you have to be an artist to benefit from art therapy. Absolutely not. The goal is accessing and expressing your emotions and thoughts in a safe way rather than about making a beautiful product. It's really process-oriented. What does a typical art therapy session look like? Well, it's normally about 50 minutes long for individuals or couples, and sometimes it's as long as 1 to 2 hours for groups or families. Art making in a session becomes a shared experience. As the art therapist, I become a witness to my client's creative process. An art therapy session includes about 20 to 25, 30 minutes of art making, and after that, we take a look at the artwork together and the imagery and discuss and explore your thoughts, feelings, associations with that imagery. What are some of the benefits of art therapy? There are many. It can help reduce anxiety, can give a sense of calm, and it can help regulate strong emotions, anger, sadness, grief. It can help increase positive connection to ourselves and our bodies and help us to understand our main relationships in the world, how we improve our relationships and our attachments with those we love. It creates possibilities of change when people lose a sense of hope. And through the art materials, we learn to experiment and to overcome fear and doubt about ourselves. Trial and error with the art materials help us to learn to make mistakes. If you would like to experience art therapy or would like to take an online workshop, please be in touch. Looking forward to talking with you.